The Medical Women International Association, MWIA, will be focused on diplomatic ties today. It is an association of female doctors existing in 90 countries globally. What is the association all about? What role is the association playing in building ties among nations of the world? Is it strictly a gender-biased group? But I know it is an association of females, dedicated frontline practitioners who will get to know about it. My guest is a health, gender, and human rights expert, also an expert in the prevention of violence against women, Dr. Eleanor Nwadinobi, first Nigerian to emerge as president of the Medical Women's International Association in the history of the organization, 100 years of existence. Diplomatic Ties continues after this time out. Stay with us. Elected in December 2019, you're 6 months into office. Will it be late to still say congratulations?
Not at all. Congratulations are in order all the way.
Heading Medical Women's International Association that existed for 100 years and being the first president from Nigeria. Is that very heartwarming?
Immensely heartwarming, humbling. I am grateful to God who gives promotion. It's also something that is heartwarming because I worked for it over a long period of time. Climbing up the ladder, I started out as a state president of the Medical Women's Association of Nigeria, which is one of our over 90 branches. And in Nigeria, we currently have over 30 state branches. And then 10 years later, I became the national president for the Nigerian Association. I then served on all the international committees before vying in elections in Vienna, Austria in 2016. I didn't win those elections.
This was your first attempt on it?
On my first attempt. Yeah. And thankfully, by the time I prayerfully, persistently persevered and pursued, I got into the position of president-elect as we celebrated our 100-year anniversary, our centennial in New York in 2019. And by December of 2019, I came into the position of international president.
And it is the international slant to what the association you're heading,
yes,
that you're on diplomatic ties today. So the question now is, how are you using this association to galvanize ties among nations of the world from the medical angle?
The fact that we are a membership and professional organization made up of female doctors and dentists from the over 90 countries, we are bound naturally by our professional ties. We cover the full spectrum of the medical the medical branches and professions and specialties. We are bound by priority issues. So the first thing we're looking at would be women's global health. We are inward facing because our founding mothers, who came together in 1919, had peculiar problems within the profession. There were so few of them that they had to band together to address their common issues. So inwardly, we're looking at issues of mentoring. We're looking at issues of encouraging our members to take leadership positions, and then we are outward facing in the sense that we are looking at health of men, women, boys and girls, but prioritizing the health of women and girls.
But you have a space for the other gender, right?
Absolutely.
Okay. A lot would imagine me having a sheet of paper today on the program. I have some 4 key areas
Yeah.
I want to quote you copiously in the course of the program. First, when the President of the Federal Republic of Nigeria, President Muhammadu Buhari, hosted you on arrival in Nigeria after your induction or investiture as the President of the Medical Women's International Association, one of the things you said, you commended the efforts of the federal government, being made by the federal government to protect Nigerians from the COVID-19.
Yeah.
You said that, quoting you, our prayer is that the same way we set a good example in the handling of Ebola, that we will also overcome and contain the coronavirus.
Yes.
Can you expatiate?
Quite simply, the coronavirus, COVID-19, is a novel virus. We are learning as we go along. Every nation on earth was more or less caught napping regarding the virus. It is a war nobody chose to fight. But within that war, we have discovered that there are battles. When I made that statement, and I really want to appreciate Mr. President for welcoming me, applauding me, and celebrating me alongside the Minister for Women's Affairs who presented me to Mr. President. I would like to applaud that because we should celebrate our own. We need to dispel that myth about prophets not being known in their, homes. But going back to your question, as I said, COVID-19 is a war with several battles. We have not gone down this path before. Having said that, Nigeria has gone down a similar path. That similar path was in containing Ebola. And I said it as a prayer. At the time when I visited Mr. President, the first case of COVID-19 had not been discovered, the lockdown had not commenced, and it was a prayer that Nigeria would use her resources and lessons learned for dealing with the Ebola outbreak in dealing in a similar way with COVID-19.
Okay. In line with your reaction,
Yes.
what advice do you have for Nigeria who at this time, as we speak, sees coronavirus, see COVID-19 advocacy, protocol, guidelines as just a joke?
You see, as first of all, wearing the hat of leadership of International President of the Medical Women's International Association, let's start from global to local. At a global level, the very first thing we did was I made a rallying call like a general would do to her troops, to our frontline healthcare professionals, whom several studies have clearly stated are female, our doctors, nurses, other allied staff who have been the frontline workers for battling the coronavirus. So the first thing was to make a rallying call to my members, to tell them that the things that they've been doing in their day jobs, they need to step up with more dedication and more hope, giving them hope that despite all the challenges, there would be a rainbow at the end of this. That was the first thing. And there's a video that is titled "To Our Heroic Healthcare Personnel." The other thing that was important to let our members know was that they're not alone. We had issues in the global north before they came to the global south. Would you believe that we had associations in the global south donating to help our colleagues in the global north? Something that's usually the other way around. We also sent out the message of self-care, because the global report was that our members were wilting, getting tired. We even heard of the case of the lady who, a female doctor who committed suicide. And so there was a message regarding self-care. So whilst you are caring for members of the public, remember to care for yourself. And then what did we do for the public that we serve? Let me come local now. The Medical Women's Association of Nigeria has an incredible campaign called the Worthy Campaign. Worthy is spelled W-O-R-T-H-I. The acronym stands for Women's Right to Health Information. What we have done, which we ramped up in response to COVID, is we use women as an entry point. Why women? Women are the bearers, the rearers, the carers in our homesteads. They make those decisions as to, this person isn't looking too well today. What is the first line of action? So we break down health information through the Worthy Campaign, women's rights to health information. Instead of using highfalutin medical words, we use everyday words to bring that knowledge through women so that they can take the best decisions for themselves and for their families.
The other thing you spoke to,
Yes.
you said the association has not only honored Nigeria, but talking about MWIA now,
Yes.
but also aligned with the president's administration, that President Buhari's administration, in stepping up to the next level.
Yes.
How do you mean?
Very clear, and I've said it before, the fact that this administration decided to take time through the Minister of Women's Affairs and Mr. President to applaud one of their own, and a woman in particular, for me, meant a lot. Having said that, it also is important to state that a lot more can be done. When you are going to next levels, it's important on the way to celebrate each milestone and celebrate each small victory on your way to the larger victory. I would like to see more women in leadership in Nigeria, women who are competent, women who know their onions, and women who can compete favorably with the men. I've said it before and it's out there in the public space. In the response to COVID-19, we have a presidential task force. Let's get more women in the presidential task force. One of the big elephants in the room right now, and nobody can say in Nigeria that they do not know what's going on. Something that I'm very angry about as an expert in violence against women and girls.
We'll come to that. Listen to the name of the International Association.
Yes.
Are you strictly for women? You don't even have a space for the male folk?
Goodness gracious me. We are a professional organization. We are a membership organization. We are an organization set aside for female doctors, or physicians if you want to use that word, and dentists. If you go back in history to when this association was formed in 1919, that was around when we had the Spanish flu.
Sure.
You will find out that the Medical Women's International Association is the longest existing medical association in the world. And let me tell you something. Whilst we were in New York at the United Nations, we had the opportunity to listen to the grandson of my namesake, Eleanor Roosevelt. And her grandson, Michael, was asked, "What would your grandmother say if she was around today?" Do you know what his answer was concerning women in medicine? That Eleanor Roosevelt will say, "You mean in 100 years not much has changed?" So we are looking for our women as vice chancellors. We want our women to be chief medical directors. We want our women, because they have, just like the men, they have the competence, they have the skills, they have the knowledge to be in those same positions. So even though things have changed, we have more females in the medical profession. When you look at the top management level, there are still very few women.
Okay, let's go to the big one that you said you are very angry about.
Oh,
So much advocacy, sustained, back end, front line, front burner every other day, as much as we even have a special day for it. What's your comments? Not all the time, but briefly on it.
I'm really angry at the level of sexual violence that is going on right now in Nigeria. We need to declare a state of emergency because there is an emergency. Yes, we are going through the viral pandemic, but there's another pandemic within the pandemic. There is an intersecting pandemic. How is it that we have had lockdown, locked in, locked within, and you have women and girls who have been locked in spaces with perpetrators of sexual violence? I read another one, the case of young Uwa. Her mother told us of what a bright girl she was. She went into a place that is normally a safe space just to read, to improve on her education. We don't know the circumstances whether it was there was no light or that it was quiet, whatever the circumstance, she was sexually violated and murdered. Just yesterday, I heard another case of a wife of a politician, again in Edo State, in her own home. If we do not declare a state of emergency, if we do not get the highest of those in power condemning in every way, these are our men who have wives, sisters, daughters. And unfortunately, there's a culture of silence and there's a culture of impunity. And unless and until we declare a state of emergency and we declare zero tolerance, and then we need to have quick dispensation of justice. All those who are responsible for responding to cases of violence, and more so sexual violence, from our executive to the National Assembly, to the judiciary, every single person walking in our communities should stand up and condemn it. And preventive education. How are we educating our children, young boys, young girls, young boys to respect? We need to remove the normalization of violence, a situation where culturally young girls are being raped in the name of early marriage. When you marry a child of 8 or 9, that is rape.
Okay, talking about looking at consent, I got to listen to somebody talk about the fact that it's not only the women who are being violated, but
Yes.
the men are also violated. What do you say about this?
Oh, no, thank you for raising that. Our young boys also are being sexually violated. And that's why I say when we come to prevention education, the first place of education is in the home. How are we raising our boys and girls? What are the positive masculinities to make boys believe in themselves in a way that they can contribute meaningfully to the society, as opposed to parents urging boys on with negative masculinities, giving them the impression that, oh, that they have won something if they go out and violate a girl. Let's protect our boys. Let's protect our girls. Let's teach mutual respect to our boys, teach mutual respect to our girls. If we are talking about virginity to our girls, talk about virginity to our boys. That respect of the human dignity is what we need to bring back into our cultures.
We are in the 25th year of post-Beijing.
Oh, yes, indeed.
And in looking at 25th year of post-Beijing, a lot, looking at the program of the UN Women, they are saying a lot.
Yeah.
Being in development world, you are aware of this.
Yes.
Now, they have come up with 12 critical areas
Yes.
of concern, and one of it is women in health.
Yes.
Looking at this and also looking at what your association is doing,
Yeah.
how do you interface it, and do you think you get somewhere so soon before we wrap up?
No, we are inextricably linked with what the United Nations is doing through the Sustainable Development Goals. Beijing is hugely important to us. In fact, I say of China that we have the tale of two cities, just like Charles Dickens, the title of Charles Dickens's book, that we have Beijing where women's rights, was really amplified, and we have Wuhan where the first reports of this virus broke out, both in China. But having said that, Beijing 25 years later, what can we do 25 years going forward so that we will not say, like my namesake Eleanor Roosevelt, what really has changed? It is, what we need is a whole of government and a whole of society approach to recognize the public health emergencies, to recognize that health must be prioritized, to recognize that appropriate funding must be set aside for key issues like violence against women and girls.
Dr. Eleanor Nwadinobi, President, Medical Women International Association, was nice having you on Diplomatic Ties.
Thank you for having me, Mr.
I believe
Remy.
if we have a next phase on the program, we shall be able to invite you to sustain the conversation.
It would be my pleasure.
Well, that's it on Diplomatic Ties today. We took a focus at the Medical Women International Association, and the president today is a Nigerian, and she's holding the office when the association has hit 100 years. For information, she's also half Jamaican.
Yes, indeed.
Dr. Eleanor Nwadinobi. I believe you had it insightful while the program lasted. Thanks for watching. Bye-bye.